Welcome back to my prostate cancer recovery diary. This episode, I'm going to go further into Lutetium-177, that fancy radiotherapy I discussed in my last episode. And in particular, I want to address why I would rather attain this treatment before and in place of any kind of hormone therapy, otherwise known by the horrifying phrase in the medical literature, chemical castration. And that bilateral orchiectomy, that's a spoiler alert. We'll talk about that down the road. Uh, those of you with a faint of heart, maybe you want to look away during that time. Let's start with this little vial of medication. That is a vial of Lutetium-177. And the purchase price? The wholesale price that its manufacturer, Novartis, charges to a hospital or other healthcare provider like your doctor or your clinic is $42,500 per vial. Yes, you heard that right. Standard treatment is 6 weeks of 6 sessions, each costing that $42,500. Your 8-month total is $255,000 just for the medication. As we'll discuss down the road, this does not include the fees for using the clinic or hospital, whatever the facility is that you'll find yourself lying down on a gurney while you receive this treatment, nor the PET scans, other fancy scans, and any other kind of healthcare professional services. The FDA approved Lutetium-177 on March 23, 2022. Approved it for the treatment of metastatic castration-resistant prostate cancer. That is, you can't get this treatment in the U.S. until you've had that androgen deprivation therapy, hormone therapy, chemical castration, and you've undergone chemotherapy. At the same time that the FDA approved Lutetium-177, it approved Gallium-68, which is a diagnostic agent, as the FDA calls it here, which is a tracer to be used in conjunction with the Lutetium-177, as we'll discuss down the road. First, you get a shot of that gallium, which attaches to your prostate cell. Then you get a shot of that $42,500 shot of Lutetium-177, which attaches to that Gallium-68. About the mechanics of this treatment. The mechanics are provided through something known as a PSMA PET scan. That's prostate-specific membrane antigen. An antigen is a protein. That protein sits on the outside of those cancer cells, those prostate cancer cells that are floating around in your body. We know they're floating around your body because you've got metastatic cancer. That is, the cancer has moved beyond its original location. That PET scan is a positron emission tomography scan, just a fancy scan, except instead of a still photograph like a CT scan or MRI, it actually measures metabolic or biochemical functions within your body. So it can identify atypical action within a cell. Cancer cells are atypical in that their metabolism is faster. They are growing faster than the ordinary cells. So this PET scan can identify those cells because they are indeed unusual in that their metabolic rate is faster than an ordinary non-cancerous cell. Jump on that table, get your shot, as we'll discuss down below, and you slide through that tube, which looks just like a MRI or CT scanner, though we know it operates differently. It allows you to take a star turn. Well, this is back in my radiotherapy days. I underwent a radical prostatectomy by robot on July 1, 2020. A little over a year later, underwent 39 sessions of radiotherapy. I tried to get the providers to let me video record my treatment. They wouldn't let me do that, but they did let me take one still shot, which reminded me of that film I'd starred in some years ago, back when I had some hair. Techs get to see on the other side of the monitor, they get to see something that looks like this. That is, the gallium-68 attaches to those cells that have a high metabolic rate because they're cancerous. The gallium, as we'll discuss, is slightly radioactive, and therefore the machine, the PSMA PET scanner, can see it as a hotspot. A little bit deeper, again, we get a shot of that gallium-68. What is that 68? That 68 is the atomic mass of the gallium atom. We get that mass by adding the protons plus neutrons. We don't really care about the mechanics of getting that number. What we care about is that number. If the number is 83 or above, we're going to characterize it as radioactive. Our gallium is hot enough, if you will, that it will show up in the display on the PSMA PET scanner, but not so hot that it's radioactive. So, for instance, your providers can do the PSMA PET scan. If the gallium does not attach to any prostate cancer cells because you don't have any. The providers don't need to follow up with what is indeed absolutely radioactive, that lutetium-177, which is significantly over that 83 mark for atomic mass. Now, it has a half-life of 6.7 days. What does that mean? Well, in 6.5 days or thereabouts, half of its radioactivity will diminish. And what does that mean? Well, for the first 3 to 7 days, that is a week or so, you are not allowed to stand within 3 feet of another person. You especially need to be careful around children and pregnant women. And what do you get for this shot? This $42,500 shot? You get about 10 minutes of access to that PSMA PET scanner. A relatively simple view, right? We've got that target protein, which again is that PSMA, prostate-specific membrane antigen. The targeting molecules are gallium-68, and then our radioactive molecule, that is our lutetium-177 attached to the gallium. We transfer that radiation into that cancer cell and hopefully do it grave harm. Talk about the effectiveness of lutetium-177. This comes from the clinical trial that Novartis, the owner of this drug, presented to the FDA to get approval. Novartis enrolled 841 patients, 2/3 of which were from North America and about 1/3 were from Europe. Randomly assigned it 2 to 1. That is, 2 out of 3 got the effective treatment, 1 got the control group. They didn't get any lutetium-177. Now, both got the standard care. The standard care could include hormone treatments and radiation therapy. So I'm hoping for further studies down the line that will separate out those treatments, because I've already had the radiation therapy and I don't want the hormone therapy. But anyway, this is what got the FDA to approve this drug. And it increased survival of these folks, all of whom had, remember, castration-resistant prostate cancer. So they'd had surgery, they'd had radiation therapy, they certainly had gone through hormone therapy to the extent that it stopped working, got the chemical castration. Once the castration stopped working, they were entitled to be enrolled in this clinical trial. So their cancer was very far down the line, and they got an extra 4 months of life. I'm 68, I'm not sure that's worth it. And there was a high dropout, the control group. Why? Well, during those 4 months, right, you're seeing the people in the other group stay alive, and your buddies in the control group are dying. That, I think, is probably the greatest illustration, at least to the lay mind like mine, that this stuff works. To the rub of at least my thoughts on this. I'm not particularly interested in that chemical castration or actual castration. I'll talk about that again in a few slides. I'm wondering, given the effectiveness of lutetium-177, is it possible to use it instead of, or at least before, that chemical castration? And there are at least 2 studies. There are 2 studies that I found very intriguing that I'd like to present to you. This first happened in June of 2022, about a year and a half ago as I speak. And it is a study of the effectiveness of lutetium-177 on metastatic, that is cancer that has gone beyond its original site, which was the prostate and the prostate bed, castration-sensitive prostate cancer. That is, the folks in this study had not yet been either physically or chemically castrated. Will this stuff work in that context? Or more directly for me, will this stuff work on me before I get the treatment that I really, really want to avoid? It's the results. Yeah, lutetium-177 works even if you haven't been castrated physically or chemically. We got significant reduction in PSA in over 90% of all patients, 50% or greater decline in PSA in about 80% of the patients, and some complete remission from the application of this fancy radiotherapy. It's difficult to compare that to the androgen deprivation therapy / hormone therapy / Lupron therapy we've been talking about, because that typically is applied earlier on in the course of the prostate cancer disease. That is, it's before you've exhausted all possible options, and now finally you're in a clinical trial, and or your insurance company will pay for this rather expensive fancy treatment. But we have about the same response. We got 90% reduction in PSA. The problem with the androgen deprivation therapy, this isn't though with the actual castration, but if you don't want the actual castration and you choose chemical castration, the results from that treatment are temporary. That is, prostate cancer cells are wily and they're determined, and they will mutate. They thrive on testosterone. They come from the area, the land of testosterone in your nether regions, as you males out there. They thrive from testosterone. They don't need it. If we deprive them completely of testosterone, that will freeze them. That will put them in stasis, but they'll mutate. And once they've mutated, they'll go about doing what they want to do, which is killing you. Study on which I particularly want to focus. The study appeared online the last day of 2022, in print 2 weeks later in the journal Cancers. Produced by a team of researchers in the Netherlands and Germany. I have spoken at length with these researchers at hospitals and medical schools in the two countries. The study was a modest size, 20 patients, for you statisticians, an N of 20, but enough patients to be statistically significant and showed great promise. Right, 2/3 of the patients get a PSA reduction over 50%, and a third had a PSA reduction of over 90%. Most importantly, it's consistent with the study we just talked about and a couple of other studies out there that Lutetium-177 works in treating hormone-sensitive prostate cancer. That is cancer in men who have not undergone either physical or chemical castration. Most important, the results with folks who have not yet undergone castration are relatively higher than the published results for those with metastatic castration-resistant prostate cancer. Yes, more effective. So it's possible, first study, the indications are this new treatment works better if you get it before you undergo castration. And why might I seek to skip over that androgen deprivation therapy / chemical castration typically done through the trade name drug Lupron and instead go directly to Lutetium-177 treatment? Well, side effects. Here we go. Those are the hormone therapy side effects. Those are the Lutetium-177 side effects. Now again, the hormone therapy is only temporary. Those prostate cancer cells will mutate, at which point the hormone therapy will no longer work, but you will have spent 2 to 3 years, maybe longer, with these side effects. Now, I would rather be tired and have a dry mouth than be subject to loss of bone density, bone fractures, loss of muscle mass and physical strength, and the development of breasts. Right? It's pretty obvious why a person might want to skip this treatment. And you've seen in my prior presentations that I view myself, my central core of my notion of who I am is an athlete. 68 years old, I've bicycled more than 8,000 miles, climbed almost 400,000 feet over hill and dale this year in 2023, in early December. I will lose that ability if I spend those 2 to 3 years being chemically castrated and will not get them back, right? Because I'll suffer the long-term consequences of that treatment and I'll be 3 years older. I don't want to spend those 3 years doing that. I may not have 3 years anyway. So from my perspective, if we know Lutetium-177 works better if applied in the absence of any chemical castration, we ought to go directly to that. The standard of care will change, subject to algorithms about cost and insurance company notions of what they owe their members. Now, let's review those costs again. Remember that wholesale cost? That is the price Novartis had stated to the FDA in the approval process it will charge providers, hospitals, clinics, or your physician per vial, per dose. $42,500. Again, typical treatment will be 6 doses over 8 months or $255,000 for the medication alone. As Michael Hoffman, an oncologist in Australia and a proponent of trying to figure out ways economically to treat prostate and other cancers, has pointed out, you also have to add in the cost of administration and the scanning. So we're talking $250,000 for the drugs and probably at least half that again for the various other requirements of your treatment. But I'll ask you, living in the United States, the only industrialized nation that does not have nationalized health care, what about coverage by private health insurance? Well, let's take a look at my insurer. I've got insurance through Anthem Blue Cross Blue Shield, and these are the requirements for Anthem to consider covering. Anthem may cover, may be approved, if I could demonstrate this. First, my cancer is castration resistant. Yep, I've either undergone that chemical castration or actual castration. I've already had conventional hormone therapy, androgen deprivation therapy. I've also had chemotherapy, and I've either had that bilateral orchiectomy, bilateral both sides orchiectomy, removal of testicles, either been physically castrated, or I've undergone what I call industrial strength hormone therapy, the gonadotropin releasing hormone therapy, which we'll see on the next slide, really does an absolute number on the ability of the male body to produce testosterone. Then and only then am I entitled to get insurance coverage for Lutetium-177. And a quick visual of that industrial strength chemical castration, the gonadotropin releasing hormone, worked with the pituitary and with the testicles to absolutely prohibit the production of testosterone, which will, of course, produce those lovely side effects. Oh, say like me, you're in the US, you're thinking $250,000 US for the medication alone because I have to undergo extreme treatment in the US in order for, one, the FDA to approve treatment of me with Lutetium-177, and in some ways more importantly for my insurance company to cover part of that, well over $250,000 in treatment costs. Go to Europe. How would you figure out how to go to Europe? Well, you go to Book Ahmed with a little heart over the eye, which has a 4.6 score of satisfaction by people who've done this, and you go to Europe. And where do you go? You go to Germany. And what does it cost? It costs $9,159 per session. Remember, it's $42,500 per session just for the drugs in the US. There, you get to walk into this nice clinic and you get accommodation for 2 days. So why that high cost in the US for exactly the same medication? Again, I can get the medication plus the healthcare providers to provide the treatment, plus accommodation for just a couple of days, but hospital costs, for $10,000 in Europe, whereas the medication alone will cost me $42,500 in the US. Well, it's Novartis. Novartis must be struggling, right? No. Novartis made $1.76 billion in the last quarter of 2023 that we've measured. Oh, it suffered a blip though. Look at those Novartis share prices. In March of this year, it dropped like a rock. What the heck happened? In March of 2023, the FDA announced a shortage. Novartis was having a hard time keeping up with demand. There are people willing to shell out this $42,500 because, as that Wall Street Journal goes on to articulate through physicians it interviewed, the loss of this ability to get this drug will kill people. So stay tuned. I have talked my healthcare provider, Yale New Haven's Smilow Cancer Hospital, into conducting that PSMA PET scan for me on January 29th of next year. Until then, we'll all just have to sit around and watch those cancer cells grow and spread. Rave on.